Welcome to Something Positive for Positive People. I'm Courtney Brain. Something Positive for Positive People is a podcast that features conversations with people living with, affected by, or even just about sexually transmitted infections. Today I have Tyrunne Johnson with us from the St. Louis County Department of Public Health. I almost messed that up. Tyrunne, what's your title?
STI Program Manager.
All right, and what did you do as an STI Program Manager?
Part of my job is to oversee the department of, we have 3 DIS, which is Disease Intervention Specialists, and part of their job is to help regulate as far as make the changes with helping assist individuals that have been affected by STIs, chlamydia, gonorrhea, syphilis, and or HIV.
Okay, and what do you mean by assist them? Are you providing them with, so someone comes in, they test positive for either of those things, right, and then what are the next steps?
If they test positive for anything, of course we get them in and get them treated. That's the number one thing. So we want to make sure we get them in and get them tested. Well, not just treated, but also test if they're a referral, a partner referral. Now, if they come in with, of course, obvious symptoms, we're going to do the test here at the clinic and go ahead and get them tested, and then we'll also get them treated before they leave.
All right, partner referrals. Is that someone who thinks they may have come into contact, or like, let's say I tested positive for HIV and I need to call like my previous partners, right, or you would notify recent partners, right, that I tested positive and that they may need to come in and get checked out. Is that what a referral is?
Good, that's a good question. More of a referral is either the partner referral or it could be assisted by the DIS, which is the Disease Intervention Specialist, which is part of our staff. Okay. So usually when the DIS does the interview, they're usually asking the person that's affected of their partner's information, and we usually would follow up from that information from those counseling sessions. Now keep in mind, which is one of the biggest challenges when you're doing those partner referrals, is confidentiality. A lot of individuals be hesitant to give that information up because they don't want to be identified as the person that gave the information. So usually whenever we get the partner information and we follow up with the partner, none of that information is given. No time, no date, no nicknames, no real names. We give none of that information to the person that we're trying to get in to get tests. Everything is completely confidential and protected for the person that did the referral.
Okay, got it. All right, so is that, I want to make sure I'm communicating this correctly. So the referral comes from a partner.
Exactly.
Got
it.
From
a partner.
Okay.
Exactly. Yeah.
All right, so what else are you guys doing here at St. Louis Department of Public Health?
The St. Louis County Department of Public Health strives to keep St. Louis County one of the best places in the region to work, live, or visit. This is accomplished by regularly assessing the health and environment of the county and responding with sound policies that help assure the availability of high-quality public health services for everyone. The St. Louis County Department of Public Health vision is a collaborative public health system entrusted to coordinate and allocate resources for prevention and outreach to promote and create a healthy and safe environment. The Sexually Transmitted Infection Program seeks to promote healthier, safer sex behavior to reduce the transmission of STIs and HIV, and to thereby reduce the incidence of chlamydia, gonorrhea, syphilis among St. Louis County residents. To this end, the STI program, we investigate reported STI cases to determine the source of the infection and ensure the infected person are treated according to CDC guidelines, offer partner services, which is including partner notification for STI and HIV testing, risk reduction counseling and treatment, or linkage to care for individuals that are HIV positive. Through evidence-based initiatives, increase the accessibility of free sexual health resources for residents and visitors of St. Louis County, which includes education as well as condoms. We regularly analyze STI epidemiological data to monitor local trends in STI incidents and guide the program decision-making. And for high rates of zip codes, that's what we go by. So we know if we get quite a few positives out of a particular zip code, this is areas where we need to put condom distribution programs. We need to get with maybe the locals in that area to possibly maybe do a testing event. So that's one of the ways we kind of can tell the positivity rate for individuals that are positive in the area off of the zip code. And that don't matter where they go. They can go to the hospital to get tests. They can go to the doctor. They can go here. Everything is still reportable. So they have to report that by law. And that's what we go by the zip codes. We conduct educational outreach to high-risk populations to increase the awareness of STIs and promote healthy sexual behavior, and collaborate with partner organizations throughout the region to improve STI screening, reporting, treatment, and prevention.
All right. So now that we got the paperwork out the work, is there anything else? Anything else you need to say here?
No, that's fine as far as that part goes. I want to make sure that to understand what the county mission and vision is here in dealing with STIs in this community.
All right. So now we're going to get down to the part where people are used to, which is just the conversational style. So the pressure's off.
That's fine. Okay.
So St. Louis, we have very high STI rates.
Yes.
What's most common? What's the most
well,
common?
of course, the most common, believe it or not, is chlamydia and gonorrhea because usually, especially with chlamydia is the most common, not just here in St. Louis, but the most common nationwide. And usually because most people are asymptomatic. And what that means is a person don't have symptoms.
Right.
So usually, if you don't have symptoms, to most people, everything's fine. That may be one of the hardest STIs to get partners to come in on because if one person tests positive and the other partner is not having any symptoms, it's usually an issue with that person coming in because of course, if you're not having symptoms, everything's fine. However, that's not the case. Most STIs that are present nowadays are coming without symptoms. Not just chlamydia, gonorrhea as well, and even with syphilis. I mean, of course, you have symptoms, and we'll go through that in a little bit. But with syphilis, sometimes you can miss the symptoms, the initial symptom for syphilis. And I'll explain that a little further as we move forward.
All right, so let's start with chlamydia then. What is chlamydia?
Well, chlamydia, of course, is an STI. It's caused through either vaginal, anal, or oral sex. So even with a condom on, of course, you're covered. However, without a condom, if the condom break, you're exposed. It's one of the most curable STIs. Just a couple pills you take and you're done. It's usually tested through urine. Where we do the urethra swab with the Q-tip. And just to give you an idea, we probably average anywhere between 35 and 45 clients a day. Okay. And then we also do the testing, the swab for gonorrhea. We test for herpes if a person have an outbreak or a lesion where we can do a culture from. Unfortunately, we don't do the blood test for herpes here. You probably end up going to your doctor for that. And keep in mind that there's two types of herpes that can be tested through the blood, which is HSV1, which is oral, and HSV2, which is genital.
Yeah, and when you say you mean like oral primarily and then genital primarily for type 2.
Exactly.
Okay.
Right. And then one more thing, we also test for genital warts. Of course, genital warts is more visual. It's not something that we draw your blood for or you urinate for. With genital warts, it's more cosmetic. So we will test for that as well. And we do the cryo here as far as like freezing them off.
Oh, okay.
So that's the method that we use. I know some facilities use different methods, but that's the method that we use here. Now, the downside to that, if a person comes in with genital warts in a situation where it's multiple warts or if it's clusters, if I had some pictures, I kind of could show you what I'm talking about. That person would probably come back for multiple treatments. Exactly right, because it can get painful. But if it's maybe single, one or two, it could probably be done the same day.
All right, so if I'm having any symptoms of STIs, I need to come in. And
exactly.
I can get checked out here for free.
Yes, and we got one more. Let me give you also trichomoniasis. With trich is also an STI now. With trich, we don't test men for trich. We test females, but we will treat. So if a person came in as a contact to someone that had trich, we will go ahead and get them treated while they're here.
Okay. Now, for all of these, chlamydia, gonorrhea, and trich, what are the symptoms? How do I know if I'm experiencing any symptoms?
Good, that's a good question. Of course, first of all, if you're sexually active and whether you have one partner or multiple partners, you still should get yourself checked out. Because in this day and age, as we see, quite a few people have more than one partner. So if you have any kind of symptoms, whether it be a discharge, burning if you're having any kind of pain when you urinate, that's an issue because it shouldn't hurt you if you have to urinate. Of course, a discharge, any colored discharge, whether it's clear, yellow, green, anything that's coming from out of you, you need to make sure you get into the whether you go to your doctor or come to your local health department to get tests.
Yeah.
And of course, if you see any kind of sores, whether it's rashes or anything that come about your body, definitely in your genital areas. If you see anything that's abnormal, of course, we have individuals that may shave in their genital area. You can have hair bumps, but just be cautious of that to make sure that's what it is. If it's something that's there and it's irritating you or bothering you, you make sure you come in. And then one more thing, another thing even with that for syphilis, because with syphilis, the primary sore for syphilis is a painless sore. And I'm not for sure if you've ever got a chance to see any pictures of it, But to my listeners that's out there, if you got the opportunity to Google primary syphilis, and we call it a chancre sore. That's what we call it in this term. But it looked like it hurt. If you see it, you be like, oh, that's painful. However, it's a painless sore, and eventually it'll go away on its own without any treatment. And then you go into another stage, which is secondary stage, which will put you in the stage where you get a rash on your body. And usually that's, believe it or not, most of the time we have a lot of people that come in once they get the rash on their body.
Okay. So
Right.
it's easy to miss if you're not examining yourself on a regular basis.
Exactly. Especially, and then it's really difficult for females. Very difficult,
Yeah.
because if it's inside the female, especially on primary, they'll never know. Unless they just so happen to be going to the doctor to get a test, and the nurse or the doctor, whoever that's examining them, happen to see it.
Yeah.
It's very difficult to track, especially if it's inside the vault where you can't see it with the eye. And then, unfortunately, with females, you'll go into the next stage, which is the secondary stage, which is the rash.
And then that's where you begin to be able to see it.
Exactly. Yeah. You see what we call palmar plantar rash, where you have a rash in the inside of the palm of your hands and the palm of your feet, and then you have a rash about your body. We kind of call it almost a crunch bar effect.
Oh, that's gross. I know exactly what you mean.
That's what your body look like. So and if you ever experienced any of those symptoms, definitely get to your local health department or your doctor to get tested out.
And you said you see about 35 to 45 people in this clinic a day?
Yes, we have the busiest clinic in this area. So yeah, and that's quite a few people. Quite a bit on a daily basis. And some days it may be slower, but average is about 35 to 40. That's average.
Now, are these positive cases of any STI, or are these just people that are getting checked?
No, not everyone comes in and test positive. Some people may just want to come in just to get a test. It may be starting a new relationship or getting out of a relationship or whatever the situation may be, just to find out their status. So we encourage anyone that's sexually active to definitely get tested. You don't necessarily have to have an STI to get tested, and that's the good thing about it. You can come here and get that test for free, and you'll have your status and not have to worry about any issues if you're in a relationship or whatever further down the line.
Man, I should have come here before I got that $500 medical bill. I went into the doctor just to get tested. I was like, well, I know I have herpes, but just check me for everything else. And then I got that bill in the mail. It was like,
Yes.
what? And I have insurance, so that's a whole separate conversation.
It really is, and that's what I think you heard me earlier when I mentioned about the cost for medication.
Yeah.
If you're not in a position where you can afford it with your insurance, you have to come out of pocket, and this medicine is not cheap. We try to encourage individuals, and we get folks with insurance to come to us, to come here where it's free and you won't have to worry about that. And, you're not. And again, what's encouraging, really positive about it is that we have the expertise here to help you with every facet that you're going through as far as in dealing with STIs. We have great nurse practitioners. The DIS, which is the disease intervention specialist, we are the ones that on the front line of this, and so we try to assist you any way we can to try to make sure that first of all it doesn't happen again if you test positive, and then we give you all the tools that you need: education, condoms, anything else that you may need.
Okay.
Oh, and also I said we do offer free condoms here too, so that's another thing. So if you not just come to the clinic to be seen, you can actually come here, and we have condoms available free here throughout the area. And before this is over, I'll mention some of the other areas that we also have condoms available.
That's fine. All right. Now keep in mind, our listeners are all over the place. So a lot of them are here in St. Louis, but we want to make sure and all of this information is going to be useful to them in their own area. So as you listen to this, don't think, oh, I have to go out to St. Louis in order to get checked. Just do your investigating on your own in your own local area. I'm sure wherever it is that you live has some sort of a similar practice to the St. Louis County Department of Public Health.
Yes.
Man, that's a mouthful. Now you say you guys treat all the facets of people testing positive. Does that include the psychological effects of a new positive diagnosis?
That's a good question. Now, as far as that, we do have support staff here for that if we have an individual that's going through that, and we also do referrals to individuals that need support because, of course, definitely with herpes and HIV, even syphilis. Those are some of those are lifelong STIs. Unlike chlamydia and gonorrhea that can be treated, the same day and gone. And trick, those will be gone. But some of the other STIs, you can definitely have some issues with emotionally and psychologically dealing with in acquiring those STIs and moving forward, even in trying to, if you're trying to build a relationship with someone, that can be a barrier for you. Especially if you're being honest up front with the person. And of course, if you keep it secretive, and it can lead to other issues down the line.
Yeah.
If you're not being honest, especially with herpes, because that's something that can come and go, and it can affect definitely can affect the relationship of anybody that's going through that.
Yeah. Now, I want to ask you about the ones that are treatable like that. Do you find repeat offenders?
Oh my God, that is a great question. All the time. I mean, you'd be surprised that the amount of people that comes through our clinic. Just say today, and you'll see them again in 2 weeks. It's just ridiculous. So it's almost like you don't want to sound like a broken record. However, we still got to treat that same person the same way we treated them last time, with education. Make sure we give them condoms. But once they walk out that door, at some point the person themselves got to take on that responsibility and make sure they do what's right, so that they won't have to come back again. Mm-hmm. But yes, we do see quite a few repeat offenders, and they come back not only for the STI that they were initially positive for, but for a new STI, and we see it a whole lot. Yes, a whole lot. That was a great question. Yeah, we do see that a lot.
In the event that, why do you think that is? Because I'm more curious about that, because in my mind, if I were to be diagnosed with something that was curable, I would be way more careful the second time around.
Right.
Do you think that this is something that you see repeat offenders for the same thing because it's curable, and because there's a solution to it, or is there something else to it?
Well, I mean, the thing is, depending on what the STI is, a lot of times if it's chlamydia, gonorrhea, we may not have the opportunity to communicate with them.
Mm-hmm.
With syphilis and HIV, we do. Most of the time, it's kind of like, just do what you want to do. Yeah. Again, our job is to make sure we give the education to that particular client. We educate them, and we also make sure we have condoms available. And we stress the importance, even if you are positive, especially for HIV, it's different strands of HIV.
Yeah.
So you may have one strand of HIV and come back positive for another one if you continue to have unprotected sex. And we see that all the time. We call it co-infections, where individuals will have HIV plus syphilis, HIV plus gonorrhea, HIV plus chlamydia. And what also that tells us is that the individual that's HIV positive is not practicing safe sex.
Yeah.
So that alone. So if you had sex with a person that was negative, not only did you possibly infect this person with chlamydia, gonorrhea, or syphilis, guess what else? HIV as well. So now we'll have a new infection there. And to get there, since we're there, to date, what we had, what's the date? The 13th. St. Louis County, not the city, but St. Louis County, we've had a total of new HIV cases, 23.
23 over what period of time?
Since the first of the year.
Wow.
Since the first of the year, 23, and that's 23 too much.
Yeah.
So, and then out of the 23, some are co-infected with other STIs.
Yeah.
The education piece is definitely important. The condom piece is definitely important. However, if the individual is not utilizing that once they leave out these doors, at some point it has to fall on that person.
And then you said you don't often get to talk to these people sometimes, and they're in and out. What do we say to the repeat offenders?
Well, we pretty much, we educate again. Like I said, education is key. We educate, we show pictures, scare tactics, because we do have pictures. We show, and again, we offer the condoms.
Yeah.
And we try to find out if there's anything else going on with that person,
I feel like
psychologically, right? As far as to where this is becoming an issue to where you constantly coming in for the same thing over and over again.
Because shouldn't it hurt? Like,
definitely. So, yeah. Well, not necessarily. Like I said, of course, if it's herpes or maybe gonorrhea if you have symptoms. But if you're not having any symptoms, everything will pretty fine. And you may be coming in on a referral from somebody you messing around with,
mm-hmm.
or of course, if you are having those symptoms, you're coming in because you're having symptoms.
Yeah.
But we see it more than what you would think.
Wow.
Yes, I mean, it's really shocking just to see that. And we see in our clinic, our age starts at 13 on up as far as the testing go, and everything's confidential. So if a teenager came in, and we encourage you, as we in the area, we really don't have too many schools that have school-based clinics to where the teenagers can go and not have any issues as far as with the parents. That'd be the biggest thing. They don't want to tell their parents.
Yeah.
Here, if you over that age, state law prohibits us from informing your parent. So you're covered as far as to be tested.
Okay.
And test and treated as well, as far as all the tests that I mentioned earlier that we will test you for.
So what's the youngest case that someone has come back positive for?
As
far as you know, for anything, someone come in and get tested above the age that you
below the age, you mean, or
above the age? I mean, because the people who come in are going to be 12, 13, right, whatever the earliest age begins at.
Oh, we've had them positive at that age, and we've had them positive at 80. So it goes. It doesn't stop. It's no particular age range.
That makes me scared to have kids.
Yeah, no, but seriously, we do. And unfortunately, we've had them positive younger than that. But in most of those cases, usually sexual assault cases. And that's not something we deal with. It's usually turned over to the authorities, and they follow up with that. But at the age where we start at here at the clinic, we get them positive all the time.
And that goes to show how ignorant I was just now, because I didn't even think about sexual assault being a reason.
Right, exactly, right. And when they're below that age, it has to be reported.
Yeah.
Because it could be some other issues going on that's not related to any of this. But if they're that age and older for our clinic, they can come in here without a parent consent and be seen.
Okay.
And be seen.
All right. So one thing we didn't talk about was HPV. Is it because that's so common?
Well, genital warts, human papillomavirus. It is common.
So HPV is genital warts.
Right. That falls upon the genital warts, right? So it is a virus. So like I mentioned earlier, we don't do any type of blood test or anything. It's more visual. And so when a person come in and they have those symptoms, then we'll go ahead and treat for that particular person. But we don't do any kind of follow-up as far as like partner notification, like with HIV and syphilis and HIV, syphilis, gonorrhea, and chlamydia. We will do that, but for like herpes as well as HPV, because they're viruses, unfortunately, we don't do any kind of follow-up with that. Okay. So if a person came in, we'll educate. We give them all the tools they need, and then we'll make sure we give them condoms. Unfortunately, you have to follow up on their own as far as moving forward, because we get calls all the time where individuals want to report someone that infected them with herpes, and believe by law we don't report that, so we don't even follow up on it.
So HIV,
nor HPV, genital warts is not either.
Okay, so HIV, AIDS, what else?
Chlamydia and gonorrhea.
Chlamydia and gonorrhea. These are all reportable STIs.
Exactly.
So if someone, and what we're saying here is that someone can report you guys to follow up with whoever they think may have infected them. Is there any cases where this may get turned over to the authorities?
Well, if that's the case, it's usually up to that person. They would have to follow up with that. The person that's infected. So they would have to follow up with their local jurisdiction wherever they live and file a report.
All right.
Yeah, that's not something that we do here.
All right, got it. So how common is herpes?
Very common. Believe it or not, prior to me working with the county, I worked in Illinois, and we had a study where we did a herpes test maybe for about close to a year. We had some federal funds. We were able to do HSV1 and HSV2 testing, and the numbers just came back just unbelievable as far as, and most of these individuals didn't even know they were positive, because they had never had the test. And keep in mind with herpes, you can still have herpes, but you can have an outbreak that be so minute that you may not even know what it is. I mean, it may come and go, and before you know it, everything is fine. Everyone do not have outbreaks, believe it or not.
Yeah.
So everyone is different when it comes to herpes. Some people, have several per year. Some don't have any at all. And of course, with herpes, the very first time you're infected is the worst.
Yeah.
Because it's new to your immune system, and your immune system is trying to fight off this virus, and that's usually your worst outbreak. And it gets better over time. I mean, whether you want to think herpes get better, but the outbreaks get better once you become able to manage them. So that usually happens, usually in time. I'm talking about, when I mention time, I'm talking about some years. It's not something that's going to happen in several weeks or several months. But as time goes, you will get better as far as managing manage this virus.
All right. And while we're on herpes, I mean, how would you have a rough estimate of how many new cases you see here?
No, I really don't. Unfortunately, however, if individuals do come in and we're able to do that culture, we will treat.
That's the only time. I'm sorry. So that's the only time you can see them is if they have visible symptoms.
Right. Exactly. Right. So even if someone comes in on a referral from someone that tests positive, unfortunately, if they're not having any symptoms, right, we'll still do the test for everything else.
Yeah.
But for the test for herpes, we'll try to get them, maybe if they have a private doctor, to go and get that blood test done there. And then, especially if they're not having any symptoms, that way they can find out if the virus is in their body or not.
All right. Man, this is a lot.
Yes.
So.
Yeah. And we treat here with acyclovir.
Acyclovir. Okay. Let's move on to what was there.
This information I'm about to give you now is the current data for chlamydia, gonorrhea, and syphilis through the year. For chlamydia, for the month of February, that's the most recent statistical data we have right now. We had 461 new cases among St. Louis County residents in February, which brought the year-to-date to 1,039 cases, which was a 9% increase compared to the first 2 months of 2017. That's for chlamydia. For gonorrhea, there were 202 new cases for the month of February, which brought the total cases to 477. And that was a 13% increase from the first 2 months of 2017, just to give you an idea as far as the numbers goes. Syphilis, early syphilis, including primary, secondary, and early latent cases, that we have known to have been transmitted in the past 12 months. There were 9 cases of early syphilis reported among St. Louis County residents in 2018, which bring the total year-to-date to 20 cases. So the difference, what we're trying to do here now is with the condom distribution programs, I mentioned that to you earlier, we have to be proactive in trying to make sure we have condoms available, because with these numbers being the way they are, if anyone from the outside come in and see this, like, okay, what are you doing to try to offset this? You know, the condom distribution program is one of the biggest things we're doing, and what that is, we supply the local barbershops, beauty salons.
Oh yeah, I read an article about that.
Right, it was in the newspaper, exactly, and a lot of them are gatekeepers, you know. So they are really big as for tattoo shops, clubs.
So we're utilizing, essentially we're utilizing trustworthy resources to distribute sexual health information.
Exactly. And we know that these are the places where majority of our people are going to. You know, and so if we have these items there for them, if they can't afford, condoms are expensive. Let's not, you know what I mean? I think I saw Magnums in the store,
a 3-pack at the gas station is like $7.
Right, you know, so, I mean, you know, that could be $7 on some food, you know, so they can get expensive if you're in a position where I need to eat, or I want to have sex, or I want to have a drink.
I mean,
you know,
depending on what station
you know, so the situation might be different. So I tell everyone, so if you're in a position where you don't have condoms in this day and age, you can. It's a place where you can get them free at. Trust me. You know, so that's not an excuse to be out here. Is out here just having sex, and your excuse when you come into the clinic is because you didn't have a condom. You know?
Yeah, and at that point, you know, if that becomes your excuse with all of the resources available and all of the education, especially the repeat offenders, then you do have something else going on. Just like you said earlier, it's completely something different outside of what you guys do here.
Right.
So looking at these numbers, I noticed that a lot of sex education focuses more so on prevention. It's don't have sex, wait till you're married, be monogamous, whatever the case may be. This method is for preparation. So if you're going to have sex, I know you are, do your best to protect yourself. Here are condoms, here's some education, here's options for treatment in the event that you get an STD or STI.
Good question. You know, and with that being said, if you come to us, you've had sex. You know, so I mean, let's just keep it real.
Yeah.
You come to us, you've had sex, and at this point, our job of abstinence is not for you if you've had sex. So once you've had sex, then now, that education come in part. Now I'm going to school you. You know, I want to make sure you got all your tools that you need while you're out here if you're going to choose to have sex. Because it is a choice. At the end of the day, having sex is still a choice. So if you choose to do this, you need to know, make sure that you're doing what's right. You know, and keep in mind, even with a condom for herpes, genital warts, guess what? You can still get infected. Yeah. You know, because it's not covered. You know, so it's skin to skin. So just remember that you can be doing everything right and still get infected. I always tell, whenever I do educations, I make sure I tell all my, anyone that's in the room or that's listening, turn the light on. I mean, you know, inspect your partner. That's your right. I mean, because you're about to lay down with this person, you can be laying down and losing a big part of your life on something that might be for worth 30, 45 minutes at the most.
I mean, that's a good day, ain't it?
You know, so, you know,
at that age, though,
and is it really worth to go through that? You know, is my thing, you know, especially, you know, if you're having anonymous sex, which a lot of my clients do, in the age we're in now with social media. That's one of our biggest barriers, you know, because individuals come in and may test positive and may not even have any information on the partner because they've met them through some app.
Through an app,
you know, and we see that a whole lot. I mean, that's probably one of the biggest barriers nowadays that we're fighting. And folks are just having anonymous sex with people that they truly don't know. Mm-hmm. You know, and so you put yourself in those positions, and especially not to use a condom. You're really playing Russian roulette with your life. You know, whenever we have individuals that come in and test positive for chlamydia, gonorrhea, syphilis, we really educate them because I don't want you to come back and test positive for HIV. But if you continue, that's one of the things you asked about the repeat offenders. That's part of the education.
Do you guys provide medication for HIV positive people, or
not here?
Medication?
No, we don't provide. However, we have a program set up to where if a person comes through our clinic and tests positive, we call what's called linkage to care, and we get them set up with a case manager. Mm-hmm. And majority goes through either St. Louis U or Wash U with their doctors if they can't afford their own doctor, and everything's free. Mm-hmm. You know, so if that as far as with individuals that test positive for HIV with medication, of course we know that's costly, and so with these different programs, it assists the person with their medication costs, not only with their medication costs, but also other issues, housing. It also assists with psychosocial issues, assists with getting employment. So it's a lot of other good positive things for that, for individuals that have test positive for HIV that they can get through case management.
And like we covered a lot in this episode. I see you still got some more paper.
Yeah, well pretty much it wasn't anything. It was just kind of more statistical data. Yeah. And we kind of, what I told you earlier, it's pretty much the same thing. This here is just more graphs and things of that nature.
Oh, so just some visuals.
Yeah, just visuals.
Okay, cool.
But as far as the education piece that we talked about, that's all what was in there. What we talked about.
Yeah,
so
well, you definitely came prepared.
Yes, indeed. Yeah.
How often can someone get tested? Like,
as often as you want.
So I can come in here this week, next week.
Right. Well, you know, if you come in that often, we got to find out what's really you got some other issues going on. You know, because keep in mind, for a male, you're getting that Q-tip stuck in you. So now, if you come back and you really you really enjoying this?
Some people may be.
Some people may. Are you really enjoying this? So, but you know, we don't discriminate as far as that goes. You can come in as often as you know as need be. And some individuals need be, depending on their lifestyle. You know, if you know you in a certain lifestyle that you require sex, you may want to get tested on a regular basis. Yeah. You know, so we definitely don't discriminate for individuals that comes in. And again, like I mentioned, we talked about the repeat offenders. Everyone that come in don't test positive. Okay. You know, and I encourage that. You know, so if you active and want to know your status, come on and get a test. You know.
Yeah. So you don't have to have symptoms to get tested. It's just usually if you have symptoms, you end up here.
Exactly.
And this is an option.
Exactly.
All right.
Yes. Exactly.
Got it. Mm-hmm. Well, this looks like a good place to wrap up this episode. Unless there was anything else you wanted to leave us with.
As far as if you want to have any questions regarding STIs, everything is confidential. You can always just email us. Go to the St. Louis County government website and go to the STI section, and you can just submit your email that way, and we will respond to you within a timely manner to try to get back with you. And when we contact you back, we'll leave a phone number for you to call if you had any further questions. And then for the condoms, for the distribution sites in the area, you can go to gettestedstl.org. That website will let you know all of the condom distribution sites that's located in not just St. Louis County, but the St. Louis region. So you would never have to worry about buying another condom again. You can always just go to these sites. Condoms are available. They're free. There's no questions asked. You go in, and whether you utilizing the services at the place or not, you can still get those condoms for free. And if all else fails, you're more than welcome to come here to North Central Community Health Center here at 4000 Jenner Station Road. And we have plenty of condoms here to where you will have to be in a situation like this.
Yeah, and I mean, while you at it, just if you're listening to this and you find yourself in one of these sites where they're giving away condoms, just take some and just like leave them places. So
Exactly. Somebody find them. Say, I'd rather them be used than to not be used.
Exactly.
So if whether you want them, if it's a grandmama listening for your grandkids, there's nothing wrong with grabbing them. It's okay. There's nothing wrong with grabbing. I just did a health fair a couple weeks ago, and we did condoms. Had condoms available, and it was quite a few grandmothers that came by and was getting them for their grandkids, and I was happy for that. That's fine, as long as
that's what they say.
Right, that's what they say. That's what they say. But if they use them, that's fine too.
All right, this concludes this episode of Something Positive for Positive People. Don't forget to follow the hashtag Something Positive for Positive People if you don't feel comfortable following or having that association with the podcast directly. At H on My Chest on Instagram, Twitter, Tumblr, and Reddit. Till next time, stay positive.
Yes.